Tumor resection and surgery, the role of an SLP. The most commonly used procedure for the early stages of cancer is surgery. Surgery involving the tongue is called a glossectomy. These surgeries are mostly performed for cancers that have not yet spread. A glossectomy is the surgical removal of all or part of the tongue. 1/3 of the tongue may be removed for smaller cancers, and that is a partial glossectomy. When the entire tongue is removed for larger cancers, that is called a total glossectomy. The tongue is our primary articulator and is involved in mastication and deglutition, which is the action or process of swallowing. The picture to the right shows the normal anatomy of a tongue, and the picture next to it shows a tongue that has undergone a near total glossectomy, which is the surgical removal of all or part of the tongue. In tumor resection, the tumor, along with the margin of normal tissue around it, is removed when possible. Surgery is also used to remove tumors that have metastasized or spread. While surgery alone cannot cure the cancer, removal of the tumors that have spread can sometimes help in long-term survival. The main tumor is removed using a method based on its size and location. After a glossectomy, both full and partial, speech and swallowing errors are likely to occur. There are 4 areas that are likely to be affected after a glossectomy: sound accuracy and intelligibility, swallowing, articulation, and dysphagia. These are not all likely to occur. Signs and symptoms of sound accuracy and intelligibility are typically judged by conversation samples, including sentences and single words. In swallowing, a video fluoroscopy and nasoendoscopy can be performed to judge if penetration and aspiration occur pre, post, or during the swallow. Articulation errors typically occur because the patient is compensating their old movement patterns to their new altered tongue structure. Dysphagia is the medical term to describe difficulty in swallowing. After a glossectomy, both full and partial, the patient may have altered swallow movements and require modifications. Some may also benefit from exercises, including yawning and chewing. Patients who have undergone a partial glossectomy will likely display unintelligible emissions, meaning they are not easily understood, vocalic confusion, typically resulting in the incorrect use of a vowel, and have accumulated more than typical amounts of saliva in their mouth. Vowel production occurs by vibrations in the larynx and an open vocal tract that is shaped in the correct form to produce a resonance pattern. Patients who have undergone a glossectomy may not be able to shape their vocal tract in the typical manner for vowel productions due to the new structure of their tongue. The tongue as an articulator is used to produce 14 separate phonemes: anterior dental sounds, alveolar sounds, palatal sounds, and posterior velar sounds. These include th, v, t, d, n, s, z, l, y, k, g, sh, and zh. Vowel consonant vowel productions such as aba, iwi, ama are ways to practice articulation. Anterior resections of the tongue, in which the front of the tongue is removed, may alter consonant productions due to the constriction and occlusion of the vocal tract. Posterior resections, more commonly in total glossectomies, also alter vowel productions because a majority of the tongue is not there to be shaped. The role of a speech-language pathologist is to find new ways the patient can use what is left of their tongue to produce sounds that are the same or similar to what they were producing before. Approximations are sounds that sound similar to the sound the patient is targeting, but not quite exactly what it should be. Listeners over time will perceive these sounds as the originals. Speech and language pathology evaluations use methods to collect data, including intelligibility ratings, articulation using phonetically based words, tongue mobility, diadochokinetic rate, which tests the placement of your tongue in the front, middle, and back of your mouth, saying the phrase pa, ta, ka, and the oral phase of swallowing. As a result of a glossectomy, both total and partial, it is common to see some problems in our patients: diminished energy levels, chronic pain, weight loss, and salivary problems. These all occur because the tongue is not able to do what it used to be able to do. Deglutition exercises can help these areas improve. Two types of speech-language pathology methods include articulation and movement. Articulation consists of drills in which the client repeats sounds that they are struggling with. Movement drills include movement of the tongue and lips, the tongue moving laterally, which is side to side, going in and out, or up and down, licking their lips clockwise and counterclockwise. The range of motion helps with strengthening the tongue. Strategies an SLP might use include reducing the rate of speech, having the client not speak so fast, timing in speech, using pauses appropriately, and using auditory feedback as a way to maintain the acoustic characteristics of the sound, having the client hear what they say and make sure that it sounded correct. Currently, there are few existing speech-language pathology intervention studies with partial glossectomy populations. Currently, it is insufficient in guiding current clinical practice, which just means that more research needs to be done so that we can help our patients who have undergone this procedure. The role of a speech pathologist is to determine the way the patients can be rehabilitated by using the available speech structures. Patients can learn to achieve new speech sound targets that approximate the acoustic characteristics of the original sound so closely that their listener will perceive them as the original. The following three strategies were valuable during speech therapy: reducing the rate of speech, temporal modifications using pauses and durations, and auditory feedback to maintain acoustic characteristics of a sound, in concordance with previously published data.